24/7. WCCO's Reg Chapman hitched a ride to see how the crew handles working in this ambulance in the air.
When every second counts,
Trauma patients have what they call a golden hour. The patient will go on this.
air medical transportation may be the only thing that can save a life.
Their survival rate of a trauma patient that's severely injured that gets to a trauma center in less than an hour, their survival rate is greatly increased.
A flight nurse, flight medic, and pilot work in tandem to provide the same quality care a patient would get in a trauma center in the air.
The emergency room in the air is equipped with the necessary tools and technology to save lives.
Whether it's a car accident, heart attack, a stroke.
1345.
These trained professionals are dedicated to saving lives in an environment that is not designed for comfort. The inside of this Bell 407 helicopter is about the size of the back seat in an SUV.
We have the stressors of flight that affect not only your med crew, but also the patients themselves, the noise, the vibration.
This critical care team is used to this. If you add up the years of experience between Tom the medic, Bill the flight nurse, and Dale the pilot, you're looking at almost 50 years.
We work in a real tight confinement, and we have to trust each other, because if the pilot has a bad day, everybody has a bad day.
Pilots are not medically trained, and the medics are not trained in aviation. What they are trained to do is to expect the unexpected.
A lot of times we're landing on intersections, we're landing in fields, gravel pits. You never know where you're going to end up being called to.
It's a heart patient with liver issues.
There is no such thing as a normal flight. Every flight is different, and you don't know what you're going to run into.
Cleared out.
On this day, the crew is called to Wisconsin to transport a patient having issues with his heart to Duluth. The more than 70 clinical staff members that make up LifeLink III either have hospital intensive care or emergency room experience.
Heart's what we're really concerned about. We want to take care of that, all right?
It's needed, especially in cases like this.
Have you ever had morphine before? No. We might give you a little bit of that stuff and some nitroglycerin for that pressure in your chest, okay? 125.79.
Patient care is important, but safety is the #1 priority.
It'll be noisy and windy when we take you out. We got about 15 minutes to go.
They will never attempt to transport if weather is a factor,
Switching over to the Duluth channel.
or if the safety of the crew or patient are at question.
Just talk to St. Mary's? Yes. We're good.
LifeLink III has strategically based helicopters throughout the region to help decrease the time a patient has to wait for help. This transport was a success, and the patient's problems were taken care of. Now these everyday heroes head home after a job well done.
There's a big reward in just knowing that you were a part of helping save someone's life.
Reg tells us LifeLink III does more than 2,000 helicopter and 200 airplane transports each year. Pilots and medical personnel undergo extensive in-service education to ensure the most advanced care and technology are provided to patients.
Pretty neat. Well, General